everyone. Welcome to today's episode of BirthVibe by BirthRight. I am Dr. Suchithra Reddy, IVF consultant. I am joined with Dr. Shreeja Karan, IVF consultant.
Hello, welcome to today's episode of BirthVibe by BirthRight. I am Dr. Shreeja Karan, fertility expert, and I'm here with my colleague today, Dr. Suchithra Reddy, for an interesting topic on IVF journey explained step by step and how do you prepare yourself. So Dr. Suchithra, could you tell us how should a couple prepare them for IVF journey?
Yes, so once they have finished the other steps of prior investigations and they have done ovulation inductions, IUI, now they have been advised for an IVF treatment. So what are the things they have to do before going ahead with the IVF process? First of all, if you have any underlying issues, so like thyroid if it is there, or if your serum prolactin level is high, or if your sperm parameters are on the lower side, or if your egg reserve is less, so we have to treat those parameters first. So for a hypothyroidism, we have to start certain thyroid medications, and prolactin levels if it is high, so prolactin has to be corrected and normalized before going ahead with the IVF treatment. And to improve your egg quality, you have to start with certain pre-medications which might include certain multivitamins and antioxidants. So there is no treatment as to increase your egg number. We can just increase your egg quality. And for a male partner, we have to give certain antioxidants. If there are any habits like abuse of alcohol or smoking or any abuse of any other drugs, these has to be stopped at least 3 to 4 months prior to your IVF treatment. You have to detox your body. You have to lose weight if you are on the above overweight or in the obese side. So make yourself a healthy lifestyle has to be done. So post that, once you start your preparation for the IVF journey, then we can think about the other steps.
So actually BMI optimization is very important step before a woman should start IVF, because it also reduces her requirement for the injections, it improves the outcomes, and it helps her in all possible ways. The pregnancy complications are also reduced, the chances of gestational diabetes, high blood pressure, everything comes down with a lesser BMI.
Definitely. So, and also Dr. Shreeja, we have seen when the woman is overweight or obese, so do they have any complications not only with an IVF, during pregnancy also?
Yes, absolutely. So high BMI or being overweight increases their chances of pregnancy complications like I mentioned, gestational diabetes, high blood pressure, preterm labor, increased chances of cesarean section and things like that. So it is a good practice to optimize the weight before they start their IVF journey.
Okay, so now the patient has been tried like around 2 years for weight reduction, but still there is no weight reduction. So should we not transfer at all, or can we go ahead with their transfers?
No, if she has been unsuccessful, then we cannot be delaying the embryo transfer.
Definitely.
So we have to start, and she has to be aware of the potential complications. So it cannot be postponed indefinitely.
Yeah. So nothing like if the patient is not able to lose weight, we can't just keep on postponing their treatment. So their patient is tried, or if the patient is in the same weight but not increasing much further, probably her metabolism itself would have been like that. So, and from the genetic also it could be on the higher side. So just considering only her obesity, we can't just keep on postponing their IVF treatment.
Exactly.
So now we will come to the IVF steps. So what all the things can to be done during the IVF process?
So the IVF treatment starts from day 2 of the cycle. So the patient has to come for a scan on day 2, wherein we assess her AFC, which is the egg count, and based on her age, AFC and her BMI, we decide the dose of the injections, and we started from day 2. The injections are ideally taken at...
So a quick question here. So do we give the same injections or same doses for all the patients, or
no,
is it a tailor-made?
Not. It's a tailor-made protocol. That's
Definitely.
why these things are important to be assessed, and that is how we decide. There are various types of injections, various doses of injection, which are decided based on the particular lady's parameters, and then we are starting.
Yes. So this is very, very important in case of an IVF treatment. Not all patients get the IVF injections or doses in a empirical, like it is not like for all the patients it is the same dose. We have to tailor-made the doses. So it is individual individualized protocol. We check their age, we check their AMH, antral follicular count, their BMI. Depending upon that, like we personalize their dose and then given.
Right. So the next step is to take injections for a span of 10 to 12 days based on again her response. So we give the injections for around 4 to 5 days and then we call her back for a scan to check how she has responded. Based on her response, then we either continue with the same dosage or we step up based on again her response and we continue the injections for another 5 to 7 days. In the second phase, we do add another injection which is called as the antagonist. There are various protocols again, so this is the most standard and the most commonly used protocol wherein the second injection is added from the 5th or 6th day based on the response.
Yeah, so patient has to be monitored regularly. It is not like you take the injections, come directly on 10th or 11th day. We have to keep monitoring the patient with the help of the scans. If we do not monitor or if we do not, certain blood tests also are done for monitoring the patient's follicular development.
So what are the blood tests you would advise?
So usually before starting the IVF treatment itself, we do what is like certain hormonal evaluation is done, like estrogen levels are checked, progesterone levels are checked, and luteinizing hormone we call it as, and follicular stimulating hormone. So these evaluation is done. So once these are all in optimal number, then we start the injections. Post the injections, again we are along with the follicular development seen in the scans, we also check the estrogen levels, whether it is increasing or not, because this gives a certain idea like how could be the response and how would be the outcomes.
It also helps us in counseling the couple, as in the response is optimal or suboptimal, how many follicles to expect based on the estrogen
Definitely,
values.
Definitely. So once the follicle reaches the optimal size, which is usually around, it can be a different parameters for different hospitals or different doctors consider, ideally around 18 to 22 we consider as an optimal growth, and once this is reached, not all the follicles, at least 3 to 4 follicles if they reach to this size, then a trigger injection is done. So once the trigger injection is given, then around 35 to 36 hours later we do the egg pickup.
Retrieval.
So how this egg retrieval is done, doctor?
So egg retrieval is actually a minor procedure, but it is done under anesthesia as it is a painful procedure. So we cannot do it without anesthesia. The patient is given sedation for 10 to 15 minutes wherein a needle is passed through her vaginal walls and the eggs are retrieved and sent to the laboratory for testing. The follicular fluid is basically removed from the ovaries and it is sent to the lab which is adjacent to our operation theatre, and then they check the number of the eggs from the follicular fluid. So all the ovaries, all the follicles from each ovary are aspirated and it is sent.
Okay, and there is a misconception here, like if we are doing an IVF in that cycle, we are utilizing their whole eggs. No, definitely not. So only that month whatever follicles have been recruited, we are going to take that. If we are not utilizing these follicles also, they are going to go die, like atresia we call it as. So even if we are utilizing, we are just utilizing this month whatever follicles have been recruited.
Right.
It is not that, it is a myth that we are utilizing all their reserve. We are just utilizing this month's recruited follicles. Definitely.
Right. So the next step after egg retrieval is basically fertilization. The next part of the job happens inside the IVF lab, which is the embryology lab.
And here also, doctor, I think we have two different methods of process, IVF process.
So there is something called as IVF, which is the traditional IVF, wherein the egg and the sperms undergo natural fertilization inside the lab. The other one is called ICSI, which is intracytoplasmic sperm injection, in which this method is basically chosen for sperms which are slightly poor in morphology and motility is also comparatively lesser. So we choose sperms based on the morphology and the best sperm is injected inside each egg. So this is basically a forced type of fertilization which ensures that the sperm and the egg at least meet with each other.
Okay, so in which cases do we choose this? So most of the time conventional IVF is most outdated nowadays. Not in all cases we use conventional IVF, but in certain cases definitely when there are young couples, when they don't have any other issues, male partner parameters are also good, female partners egg reserve is also good, we have got multiple number of eggs. So in that cases cases we can actually divide those eggs. One set of eggs can be done with a conventional IVF, or other can be done with an ICSI procedure. So not all cases undergo ICSI. Yeah, definitely few cases also can conventional IVF can be done, but now I think most of
the
centers
do this
are doing ICSI procedure.
But yes,
itself.
IVF should not be completely out of the system. It is a good practice if the male parameters and if everything is good, we should definitely opt for IVF.
Yes, definitely. So
another thing is a lot of patients ask if there is any difference between the fertilization which happens through IVF or ICSI. What is your say on that, doctor?
See, what happens here in a conventional IVF, again it is the natural selection of sperms which is going to be happening. But in some cases where there is fertilization failure at all, we can't keep on repeating to do this conventional IVF. In such cases, we have to go ahead with the ICSI procedure. But definitely it is a natural selection which happens in case of a conventional IVF process. But because of increasing male factor infertility and reducing morphology, we are trying to move towards the ICSI process than going ahead with the conventional IVF.
Right. So after the IVF or ICSI has been done, the embryos are cultured inside the lab for 5 days, and it's usually checked at the 3rd day to see how the embryo development is happening. And all the centers these days are practicing a day 5 culture, which is called as the blastocyst culture, which gives us embryos which are good enough to be implanted. So what is your again say on day 3 versus day 5 embryos, doctor?
See, I usually prefer a day 5 transfer than to go ahead with only a day 3 transfer. So most of the time when there are multiple embryos which are getting formed or multiple eggs we have done an ICSI process, it is 50 to 60% can go ahead with a day 5 process. So the day 5 success rates are definitely high compared to a day 3 success. So I usually prefer to go ahead with a day 5
But then there
transfer.
are cases when we have very few embryos which are not probably looking that great. So then what would you do? Would you discard them or would you freeze them for a transfer?
So in such cases, definitely we can freeze on a day 3 and then try. See, sometimes what will happen in the lab if they're not growing the environment in the uterus is more better than in the lab.
Basically
so
a natural
home. So in that cases, we can, when there are less number of embryos, we can definitely think of a day 3 embryo transfer and go ahead with an embryo transfer. So this completes the IVF process of making the embryos. That's
right. So this is half of the IVF is basically done.
So then comes your preparation for the embryo transfer. So there are again 2 different types of transfer, either a fresh transfer or a frozen embryo transfer. Usually fresh transfer is done when we have less number of embryos or the levels of hormones are in the normal range.
That's extremely important to be assessed.
Definitely. So once this is done, then we go ahead with the embryo transfer if they are lining, everything is good. But in many cases, we nowadays prefer for a frozen embryo transfer. So what do you think about the frozen embryo transfer?
Frozen embryo transfer is definitely better. It gives better outcomes in most of the cases because the hormones are optimal. The body has kind of recovered from the stimulation. But then there are situations when we are doing a mild stimulation or we are doing only natural cycle. Many centers are again doing that. In that case, we definitely go for a fresh embryo transfer.
So it is mainly about the patient's body, their hormones and the embryo which is being formed. So depending upon this, we can choose to go ahead either a fresh transfer or a frozen embryo transfer. IVF is usually a 3 months process. First month is where we take the eggs and make the embryos. Second month we give you a break to recover from the IVF process and the hormones, everything has to come back to its normal. Post that, the 3rd month, which is the frozen embryo transfer preparation happens. So this is the IVF journey which you have to know, and you can go ahead with the IVF process.
This is all about the IVF journey. Stay tuned for our next episode on embryo transfer.